Let's get it going, man.
All right.
All right, top of the afternoon, everybody. Welcome to Coffee and Conversation. It's a great day. It's raining outside, but it's sunshine inside. All right.
All right.
So today, my name is Craig. By the way, if you're not familiar with the show, this is our hybrid meeting of Coffee and Conversation, and I'll let the gentleman to my right introduce his own self.
My name's Mike, one of your grateful recovery coaches, and we're going to go through do this lesson, part two of this lesson that we had started last week.
Okay.
And we're going to finish this out. Oh, I was about to tag Karen, but
What's the name of this one?
Multiple pathways of recovery.
Okay.
Multiple pathways of recovery. So we're going to do those. We're going to finish part two. We started last Thursday, right?
Absolutely.
So we're going to finish up on that. Let's see what we got. All right. All right. I did all my sharing. Logged in. All right. So we got this pathway from recovery. It's a PowerPoint presentation. And we're going to see what we got here. So last week we were talking about multiple pathways of recovery. And a few things that we went over, I'm going to give you a brief recap. One of them we went over, we was talking about integrating multiple pathways into peer recovery. What that means is a lot of people haven't come around or embraced many pathways of recovery. So you have to think about ways that you can integrate that into your peer recovery coaches or counselors. So then we talked about different pathways. The first pathway we talked about was peer recovery support services. Peer recovery support services, and we talked about 3 types of mutual help organizations. And we're going to move on now let's talk about medication assisted recovery. All right. So that's what we're going to do. We're going to talk about medication assisted recovery. And then we go from there and see what we got. Okay. Let's do it. So let's see what we got here. I'm sorry. My bad. I forgot. I can actually put it on the screen for y'all. Hey man, listen.
Yeah, we live. This is a hybrid meeting.
Bam. There we go.
You can also attend in person or you can watch it on screen. I know it's comfortable being at your place of residence or wherever you may be. However, it's also good to be amongst your peers.
Oh man.
Right?
So let's do some reading here. Let me see. Oh, I can read it from here.
Oh, okay.
So right. Medication assisted recovery. Medication assisted treatment is as defined by SAMHSA for integrating health solution is the use of pharmacological medication in combination with counseling and behavioral therapy to provide a whole patient approach to the treatment of substance use disorder. The organization addresses changing attitudes, beliefs, and the perceptions to ensure comprehensive cultural approaches. Health services are available for assessing the patient's diagnosis with opiate use disorder. Opiate use disorder is a chronic disease, and evidence demonstrates that treatment is effective and recovery is possible. MAT at facilities, a comprehensive evidence-based approach for recovery that combines pharmacological interventions with substance abuse counseling, social holistic services that are supportive of cultural practices and belief. The reason why when you think about medication-assisted treatment, and I'm a faith-based person, right? When I initially started, before I was grounded in my faith-based approach, I started with medication-assisted treatment and got on Suboxone because I couldn't deal with the cravings I was having. Even though I was going to grow to the level where I have grown to spiritually in my faith of everything, I didn't discredit taking this route. I just, at that particular time, I didn't throw it away and say, I'm a faith-based person. I'm going to just wait on God to do it. And I remember one day I was sitting home and my wife said something and she said, "You think God gonna come down here and grab that crack pipe out your hand?" And I said, I'm like, "He's not going to, it don't work that way." He said, "Nah, it don't work that way." The reason why I say that is because if you read up here it talks about addressing changing attitudes. Changing attitudes. That part goes connected with MAT, the change of attitude. Opiate use disorder is a chronic disease as is testable. The goals are to support recovery and prevent relapse with medication and psychosocial therapy. Medication in support of recovery is one of the parts of comprehensive approach towards achieving long-term, recovery. All right. Now what's next? What you got?
Now let's look at inpatient and outpatient treatment.
All right.
Let's see what that's all about. All right. It says inpatient and outpatient treatment. Inpatient rehab versus outpatient rehab. Let's talk about inpatient rehab. There are eight of them. Number one, it talks about patient stays in the facility. 2, higher success rate. Now we're talking about inpatient. Number 3, more expensive. 4, disruptive to daily life. Number 5, talking about 24-hour medical and emotional support. 6, 28 days to 6 months program. All right, so that's more of a short-term stay. Number 7, designed to treat serious addictions. And number 8, no distraction of everyday life.
So inpatient, it takes away the possibility of all the distractions that you have in everyday life because you're inpatient, you're away from that environment.
And so the comfortability or the norm of comfortability that you may be accustomed to is limited.
Right.
All right. And so outpatient deals with number 1, patient stays at home but goes to treatment during the day. Number 2, lower success rate. Number 3, more affordable. 4, patient maintains a more normal daily routine. And what that routine may be like, go to work, be around families, attend meetings, go home. Number 5, accessible to social circle support. Number 6, 3 months to over 1 year program. Number 7, good for someone with a mild addiction. Number 8, 10 to 12 hours a week. IOP.
Yeah, but so you see, look at number 1 at the outpatient and number 8 at inpatient. And number 8, it says no distractions of everyday life. That's inpatient. Outpatient says patient stays at home and goes to treatment during the day. So at outpatient, they got a lot more distracted, a lot more. That's why I always tell people who successfully complete outpatient, I always not say they're better than the person who went to inpatient, but I think that they have a lot more distractions because they home. They got a lot more distraction. And a lot of times people be in inpatient, they say, oh man, I go to this program, they got drugs in there. I said, yeah. They said, yeah, man. I said, how many people was in there? They said 45 people and like 3 of them had drugs. I said, it's drugs on the street. So if you can't make it in there with that many people with drugs, the success for you out here is going to be very difficult. Realistically, I mean, we could try to sugarcoat and say, oh, no, you're going to make it. No, a lot of the situations in places where people are having drugs just normalize the situation you're going to face when you come home, basically. So it might increase. Oh, you want to read this?
Oh, wow. Drug and alcohol treatment programs generally fall into one of 2 categories, inpatient or outpatient rehab. While equally focused on rehabilitation, each type has unique attributes and benefits to offer. Inpatient rehabs are intensive residential treatment programs designed to treat serious addictions. Outpatient, on the other hand, rehabs are part-time programs allowing the recovering youth to keep going to work or school during the day. It is important that both the addicted person, and their loved ones understand the differences before selecting a treatment program. Finding the right treatment program can put you or your loved one on the road to sobriety. It's optional.
It's optional. Let's go. Let's see what we get. Inpatient. It said family support and contact and inpatient rehab. Successful inpatient clinics know family involvement is critical to recovery. This is very true. When a person is struggling with any type of substance, trying to get the person's family involved in that person's process increases the chances of them succeeding, because a lot of times people don't understand what that person may be going through. And not only that, the family member might be going through their own situation. It might not be a substance use disorder. It might be from the effects of that person with the substance use disorder. So the family dynamic, when you have if what we call family sessions, if you get a family session, it's possible to be able to get some resources for the family member that they need at the same time while the person who struggled with the substance use disorder is getting the help that they need. So it's a family dynamic.
Greater awareness, become inclusive.
Better. Family members can contact loved ones in residential treatment to prevent emotional support and encouragement. When it comes to how and how often residents can communicate with their loved ones, each inpatient center policy is different. Some rehab centers also provide counseling for the addicted person's family. I was just mentioning that, and I didn't even read it yet. Outpatient rehab and treatment. Outpatient drug rehab is less restrictive than inpatient. Outpatient rehab programs usually require 10 to 12 hours a week spent visiting a local treatment center like we have First Step. These sessions focus on drug abuse education, individual and group sessions, and teaching addicted people how to cope without their drug main purpose. Outpatient drug rehab can be a good standalone option for someone with a mild addiction, or it can be a part of a long-term treatment program. Outpatient drug rehabs can last 3 to 6 months, something similar to this inpatient treatment for over a year. So you want to try to connect to outpatient if you have a situation where it's not really severe, it's mild. It's easier to go to outpatient and then work yourself that way. But if you have a very sincere case, it's easier to go to detox treatment and then come home and make that part of your treatment program.
Outpatient.
Yeah.
It's a three-step
process. Whatever the decision, recovery is around the corner. No matter what treatment option you choose for you or the loved one, rehab can change your life. Addiction is a chronic illness, and recovery is a lifelong process. Medical professionals, mental health counselors, and community groups like AA can teach the necessary skills to avoid relapse. Take the first step today. If you out there today, I'm gonna pull over, pause, and park right here. If you out there today and you are in need of some type of help, you can always reach out to us. Our number is on the screen. You reach out to us and we can either help you get into whatever type of treatment you want. It can be outpatient, it can be inpatient. It doesn't matter. Whatever you are willing to do, we are here today. The number is on the screen. You can reach out to us and we're here and we can help you. Just let us know. All right. Thanks for tuning in. Let's go back to the lab. See what we got here, Mr. Daniel.
In summary, the brain reacts differently to different addictive substances over time and frequent use. Withdrawal symptoms aren't pleasant for any drug, but some drugs should never be quit without medical supervision.
That is very important right there.
Very important.
Because a lot of times people be thinking this way. Why don't you just stop?
Cold turkey.
Yeah.
That's an old method.
That's a terrible method. Hey, some drugs should never be quit without medical supervision, because some drugs can cause you to go in such a bad withdrawal that you could possibly die from the withdrawal. So that's why it's recommended to go to detox, especially when you're dealing with something like fentanyl, opiate, things like that, alcohol. Those are things that you want to probably have medical supervision around the individual. So telling them just stop is actually the worst idea ever, to tell somebody to do that when they need medical supervision. I'm not a medical professional, but I know for a fact that some withdrawals can be very intense, especially when you're dealing with opiate, alcohol, and other things like that, fentanyl. So go ahead.
And that's why it's so important, as we just read previously, when we talked about medication-assisted recovery.
Yeah.
That's so important. A lot of people just can't wean themselves off of that.
Yeah.
Some withdrawals can be fatal. Lethal withdrawals are linked to drugs like synthetic opiates, benzodiazepines, alcohol, and heroin. During inpatient rehab, patients have access to 24 hours medical attention. This attention can mean the difference between relapse and recovery.
Lethal. I ain't even look down there.
Deadly.
I ain't even look down there. All right, let's see what we got here, man. We're going good. Now let's look at psychotherapy, all right? Psychotherapy and cognitive behavioral therapy. I like that CBT. Cognitive, the brain. Psychotherapy or talk therapy is a way to help people with a broad variety of mental illnesses and emotional difficulties. Psychotherapy can help eliminate or control trouble symptoms so people can function better and can increase well-being and healing. Problems helped by psychotherapy include difficulties in coping with daily life, the impact of trauma, medical illnesses or loss, like the death of a loved one, and specific mental disorders like depression or anxiety. These are several different types of psychotherapy, and some types may work better with certain problems or issues. Psychotherapy may be used in a combination with medication and or therapy. So psychotherapy or cognitive behavioral therapy deals with our change of mind, thinking ourselves different. I always talks about I think myself happy, and then when I say that, I literally mean it. Like if I'm having any type of day that doesn't appear to be a normal day to me, I think myself happy. How do I do that? I meditate on things that are good. I meditate on things that are pure, that are holy, I do that. And the more I do that, I think myself happy, literally. Therapy may be conducted in individual, family, couple, or group settings and can help children and adults. Sessions are typically held once a week for about 30 to 50 minutes. Both patient and therapist need to be actively involved in psychotherapy. The trust and the relationship between a person and his or her therapist is essentially to working together effectively and befitting from the psychotherapy.
Now let's talk about it a little bit. I noticed up front it says psychotherapy or talk therapy. Now they have what they call the ABC method when it deals with CBT or cognitive behavioral therapy. Now the A is the activating events and the B is the self-talk or the belief or core belief that one perceive of the activating event. And the C will deal with the consequence. And so if you see an activating event and you have this self-talk, and that self-talk should be either that a positive or negative one will have, they're going to bring about the consequences. And so if you see an activating event and your perception of it, if you look at it from a positive perspective, 9/10 of the time, your consequence is going to be a reward of positive behavior.
You got to see how you seeing it.
Absolutely.
Or if you, because you can see something
totally different. We will look at the same thing.
Yeah, we were just saying that. We were just talking about something and we seen something and we said somebody else will look at it and say, that person did it. But that person wasn't even nowhere near there, right? But if you have that mindset that your perception of the thing is one thing, if you lock in on that, then it's going to be hard to change. All right, psychotherapy and cognitive behavioral therapy. Types of psychotherapy. Therapists may combine elements from different approaches to best meet the needs of the person. Cognitive behavioral therapy, one of my favorites, CBT, helps people identify and change thinking and behavioral patterns that are harmful and ineffective, replacing them with more accurate thoughts and functional behaviors. It can help a person focus on current problems and how to solve them. It often involves practicing new skills in the real world. CBT can be helpful in treating a variety of disorders, including depression, anxiety, trauma, related disorders, and eating disorders. For example, CBT can help a person depressed and recognize and change negative thought patterns or behaviors that are contributing to the depression. So a lot of times I always talk to somebody that I'll be mentoring and I ask them, okay, start me from the beginning. And they say, what you mean? I say, okay, you in the bed sleep. So they say, what you do after you got up? Start me from the beginning. And then when I talk to them and then I'm focusing on what they've been thinking all day, I could tell them how they ended up in that state. Because all day long, all they did was think about what happened wrong, what this is wrong. They did absolutely no way that they feed their mind any positivity. And that's why they was in that particular state of mind.
And the slump.
in the slump. Interpersonal therapy is a short term for treatment. It helps patients understand underlying interpersonal issues that are troublesome, like unresolved grief, challenges, changes in the social or work roles, conflict with significant others, and problems related to others. It can help people learn healthy ways to express emotions and ways to improve communication and how they relate to others. It is most often used to treat depression. So it says that it can help people learn healthy ways to express emotion. Most individuals that use any type of substance or alcohol just lack the ability to express the emotion that they probably was feeling before they did whatever. There was no way. That's why you got to learn interpersonal therapy is good. All right, let's see. We're moving good here.
Dialectical behavioral therapy is a specific type of cognitive behavioral therapy that helps regulate emotions. It is often used to treat people with chronic suicidal thoughts and people with borderline personality disorder, eating disorders, and PTSD, post-traumatic stress disorder. It teaches new skills to help people take personal responsibility to change unhealthy or disruptive behavior. It involves both individual and group therapy.
Good stuff.
There's a two-pronged approach to dialectical behavioral therapy, and it deals with not only the mental aspect, but also the physical aspect. All right. So supportive therapy. All right. So uses guidelines and encouragement to help patients develop their own resources. It helps build self-esteem, reduce anxiety, strengthen coping mechanisms, and improve social and community functioning. Supportive psychotherapy helps patients deal with issues related to their mental health conditions, which in turn affect the rest of their lives. Supportive therapy. Nice. So that's what we're not therapists here, but we as recovery coaches, we offer a supportive group. And this is a hybrid supportive group that we can assist you with the right people if you're dealing with some type of mental health, right?
Psychotherapy can be short-term, a few sessions dealing with immediate issues, or long-term, months or years, dealing with long-standing and complex issues. The goal of treatment and arrangements for how often and how long to meet are planned jointly by the patient and the therapist. So whoever you connect to, y'all want to work out that plan. Cognitive behavioral therapy is important to emphasize that advances in CBT have been made based on both research and clinical practices. Indeed, CBT is an approach for which there is ample scientific evidence that the method that has been developed produces change. In this manner, CBT differs from many other forms of psychological treatment. So, you got all these psychotherapy, and you also have spiritual counseling. You can get spiritual counseling that you can go to. It's so many. That's why I'm talking about many pathways. There's so many different pathways, and a lot of times I said this in last week, a lot of times we get so narrow-minded that if a person doesn't take our pathway, then they didn't successfully achieve what we achieved, which is one of the things that we can't. It's not smart. That's not really true.
It sounds like we're doing more harm.
Yeah. So what we were talking about today, we're simply talking about many pathways of recovery, and we're going to finish on part 3 Thursday. We're going to do part 1, part 2, and part 3 because I don't want to force feed this to you. You have to watch this video over, like, share, subscribe, and share this video and comment. You know what I mean? So you want to try to look at it over and over again. And if you are in the field or you think that someone has to always just take your path and if they don't take your path, it's not valid. That's not true. Because me personally, I had to use the MAT part first, right? Then I went into, I was heavy into like the NA recovery room. And then I built my spiritual foundation. So I use every different pathway to get to a particular destination. It wasn't that one thing would have worked, this would have worked, whatever. I can't talk about you. I don't want to talk about me. I had to use multiple pathways to get to that destination. And so I don't want people to be discouraged if they feel like that they had to take other alternatives or other routes to get to the destination, because ultimately the goal is for you to stay clear, stay free, and never go back to relapse ever again.
And this CBT thing that we just spoke about, literature that we spoke upon, is very important because a lot of people who have substance use disorder has shown and proven that they either suffer from some type of trauma, some type of anxiety or depression, or PTSD, post-traumatic stress disorder.
Good stuff, man.
Right?
All right, so we see you on Thursday. I'm sorry. Live at 5.
Yeah, absolutely. Live at 5, MIT Men in Training. We'll be up at 5 today. Please tell a friend, be a part of what we're talking about. And it's a very informative